I hope this video will give you a glimpse into the culture, mission, and strengths of our program. We believe in specialized, evidence-based, whole-person care and helping our patients with serious illness live as well as possible for however long they have to live. Whether it's a few days or a few years, even in the context of incurable illness, our patients deserve the best care.
Ours is among the oldest and most established fellowship programs in the country. In fact, we added the first pediatric palliative track on the West Coast.
Our graduates are proficient in practicing in any palliative setting, whether it's inpatient, clinic, hospice, and even home-based palliative care.
Since our outpatient palliative clinic opened in 2015, we have been providing high-quality palliative care to patients with serious illness with a focus on virtual care delivery. Now we are a leader in the region in providing virtual care. Many of our patients have severe functional limitations. Before they qualify for a home program like home-based palliative or hospice, we can provide comprehensive outpatient palliative care virtually.
We believe in the importance of close mentorship, not only to train effective clinicians, but to also develop expert educators and leaders within our field. Our fellows meet regularly with our faculty throughout the year for program director rounds, leadership rounds, and scholar rounds.
I have so many years, about 35 years of experience and practice to develop part of the curriculum and, more importantly, to mentor the fellows through leadership rounds and lectures.
The faculty here at Kaiser Permanente wanted to incorporate a program of wellness. So along with my colleague Tracy, we have developed a portion on resilience and self-care. My part of the program has to do with understanding your inner world. There are a series of skills and practices that are done in an experiential way, which were taken from the University of Santa Monica, and they are taught to the fellows and practice, and ultimately the idea is that they'll better understand themselves and how they interact with complex health systems and preventing burnout, increasing resiliency, and better satisfaction, not only in their job, but also in their life.
The vision of the Balance Group is a blend of the medical and the psychological fields to promote psychological awareness, which enhances connectivity, and it decreases burnout, emotional isolation, and moral injury.
Communicating treatment options in the context of serious illness is a critical skill needed for all palliative medicine fellows. By practicing in an integrated system within Kaiser Permanente, one is able to really understand the transitions of care that are so critical for these patients. From the clinic to the hospital to the home, one can develop a skill set in order to become an expert palliative medicine physician. Couple this to Kaiser Permanente's long history in graduate medical education with over 34 residency programs, and its synergy with the Geriatrics Medicine Fellowship and Kaiser Permanente School of Medicine, where we were able to recruit highly sought after medical students from throughout the nation, you will know that you will receive an excellent training in palliative medicine at Kaiser Permanente Los Angeles.
As someone having gone through the program, I can attest to the high quality of the education I received. And I would say this is in large part due to our faculty. They take teaching very seriously in order to positively shape the future of palliative medicine. By the end of fellowship, I was more than prepared to pass the boards and practice independently as an attending in a variety of settings, including inpatient, outpatient, home visits, and skilled nursing facilities.
What really drew me to the Kaiser Permanente Fellowship was the fact that we have such an integrated program, which includes not just inpatient settings, but also an outpatient clinic and home programs. So there was a lot of continuity of care where I could see patients across these settings.
We have really established great relationships with the specialty services throughout the medical center, especially with oncology, where we've had multiple collaborations. One key facet of building this foundation at the medical center is in our dedication with teaching residents. We have core rotators in internal medicine, family medicine, neurology, and OB-GYN. And This provides ample opportunities for our fellows to teach.
One of the programs that I do with the Palliative Fellows is a spiritual care workshop in which we explore spiritual care issues, existential distress, very common issues that come up on a daily basis with our patients and their families.
I host monthly scholar rounds, which allows for one-on-one mentorship to support the fellows in their own speaking and publication opportunities. Through these relationships, I help fellows in job search and provide a forum to discuss balance of work and non-work life. Given that our specialty reminds us that life is both precious and fragile, we also prioritize fun here, whether it's through a virtual happy hour or a day at the beach.
I'm inspired daily by our faculty and fellows' focus on the patient and not the disease, and have really learned a lot about life, actually. These learnings have brought me a new sense of purpose for my role and has grounded me with our program's mission, as it has for all the fellows who've come through our program and gone on to become effective leaders in the field. I'm very excited to welcome those to come.
Thank you for taking the time to get to know our fellowship program. I hope that you were able to capture not only our passion, but also our uniqueness. Take care.